Beware of allergy-causing foods for your baby. If you are taking care of a child or a baby, it's not uncommon to see certain allergic reactions that might not have any trigger. Your child might develop a skin rash the next morning, may get constipated, fall prey to dehydration, get cold or even get fever due to unknown reasons. While most of these problems side away with proper care and medications, finding the roots to avoid them in the first place often helps prevent the worst-case scenario firsthand. Allergy-causing foods for your baby. It is a fact that the newly developed body system of a baby has certain vulnerable organs that are yet to function in a pristine manner. This can give rise to allergic reactions when through various foods your baby is consuming. You need to beware of allergy-causing foods for your baby. Many allergy-causing foods can harm your baby in different ways. Let's discuss those in detail. The troublesome foods. Once your baby starts feeding, you need to take care of foods that might cause any sort of allergic reaction. While some might pose less threat, others might be high potential. These all need to be identified, and as a parent, you should always look out which allergen is causing which type of allergy. There are some common foods that may cause more problems than others. These are shellfish, tree nuts, peanuts, cow milk, eggs, wheat, walnut, cashew fish, soy. Types of allergies. It is estimated that 6% of children suffer from various types of food allergic reactions. The reactions can range from small itching to diarrhea and so on. These reactions are usually the body's response to any allergic foreign substance that is entering the body of the baby. Many allergies are associated with skin problems as babies have highly sensitive skin. This makes them more likely to develop rashes or marks. A slight irritation to the soft skin of the baby can trigger a rash. If you can identify the type of allergic reaction, it becomes easy to develop a course of action for the cure. Hives. This reaction occurs when the body of a child releases the histamine chemical in response to an allergen. The release can cause the onset of hives and related allergy symptoms. One might wonder what exactly is hives. It is an itchy raised patch on the skin. These can range in size, can be large or small. The color is usually red or pink with a thin border outline. Hives may appear anywhere on the body of the baby and hence, can be difficult to locate. You should look for symptoms or changes in your child's behavior such as itching or irritation. Eczema. This is a common skin condition that can conjure your baby as a result of an allergic reaction. Atopic eczema, which is most popular, can affect babies and small children. The rash of eczema appears as a red bump. It might turn into a scaly mark or dried skin area later. The reason why babies develop eczema as an allergic reaction is not certain yet. Many researchers believe that it is genetic or environmental factors. You should look for eczema signs such as outbreaks in body or irritation. Various irritating fabrics, adverse chemicals, soaps, and climate conditions can also trigger eczema allergies. Papular urticarial. This is also a localized type of reaction which occurs from a bug bite. Very common in children, the bites can be caused by insects such as bedbugs, mites, and mosquitoes. This indicates that each one of us should take proper care of pest removal and keep our premises hygienic. The allergy affects children aging between 2 and 6 years. There have been chances where this reaction has occurred in infants as well. The indications include small clusters and red bumps or bug bites. The bumps may also be filled with fluid. Course of action. It might be an intimidating experience watching your child suffer from an allergic reaction. But the right course of action is to stay patient and act in a wise manner without losing your calm. Before seeking help, it should be understood that not all allergies require treatment or medications. Various rashes may subside on their own if you wait for 3 or 2 days. The problem arises if the problem persists more than a week. Various rashes occurring from simpler causes such as contact with irritating fabric or with a dust particle can get treated on their own. Precautions. As with all treatment procedures of babies, this one also includes a collective effort of certain steps that need to be considered. The first thing you need to do is to prevent triggers of the allergy. Various foods react in a potential manner when there are allergies triggers already present around the baby. For instance, a baby in dust might develop allergies quickly from cold water as compared to that in a clean environment. Various chemical products such as soaps, perfumes, lotions, and cleaners can cause allergic irritation. One can always go for hypoallergenic products instead of these. This way, you can beware of allergy-causing foods for your baby. The other thing to avoid is to use already used utensils. It is a general rule that no same utensils should be used twice. For feeding babies, the process can accumulate germs and bacteria on the outer lining of utensils and can cause an allergic reaction. You should wash the utensils, be it a plate, a spoon or a mug, before feeding the baby. It is a general rule that no same utensils should be used twice for feeding babies. The process can accumulate germs and bacteria on the outer lining of utensils and can cause an allergic reaction. You should wash the utensils, be it a plate, a spoon or a mug, before feeding the baby. When it comes to feeding bottles, hygiene comes at first. Many babies develop allergies as they are getting milk in dirty milk bottles. The first guideline is to simply avoid using plastic milk bottles for babies. This is because firstly, plastic is bad for our environment. The non-biodegradable substance has already proven to be devastating for our planet Earth. Shifting to glass bottles instead, we can provide a better future for our generation. Secondly, plastic bottles are known to deteriorate as they are subjected to various sterilizing cycles daily. Precautions when dining out. When your child has at least one food hypersensitivities, feasting on the outside premises can be a complication. Be that as it may, it is conceivable to have solid and fulfilling dining out understanding. It just takes some readiness and steadiness on your part. When you are dining out, you need to be precautious of certain things that might help you in keeping your baby safe and away from food allergies of all sorts. Firstly, you need to realize what are the ingredients present in the food you are eating. And whether there are any harmful or allergic substances included in the preparation. When at a restaurant, it is always a good practice to ask the waiter about the type of cooking methods they use. You can mention the allergic food of your baby and ask him to avoid at all costs. Whenever the situation allows, acquire a menu from the cafe early and survey the menu things. Tell your server from the earliest starting point about your child's food allergy. The individual in question should realize how each dish is prepared and what fixings are utilized. Get some information about readiness and fixings before you request. If your waiter doesn't have the foggiest idea about this data or appears to be uncertain of it, request to address the supervisor or the gourmet expert. When dining out, it is always a wiser decision keep away from buffet-style or family-style menu course, as there might be cross-combination of foods, from utilizing similar utensils for various dishes which are a strict no for your child's allergic symptoms. Another important thing to look into is that you should maintain a strategic distance from singed foods, as a similar oil might be utilized to sear a few unique foods. Note that the procedure of dining out with food sensitivities is to give your waiter or the administrator a food allergy card. A food allergy card contains data about the particular things your child is hypersensitive to. Alongside extra data, for example, a suggestion to ensure all utensils and hardware used to prepare your meal is completely clean preceding use. You can, without much of a stretch, print these cards yourself utilizing a PC and printer. In case your child is eating out with companions and you won't be available, give your child a food allergy card, or ensure the grown-up in control has one, to provide for the server. Conclusion: baby's food and feeding routine are some of the most important things to look after when you are caring for your child's growth. At first, babies do not demand any toys or any other materialistic things. All they want is milk. Concluding, it becomes important to mention that many children are born with no allergies at all. However, during the course of their growth, their body system might develop certain allergies to certain foods or ingredients. This is normal and nothing to worry about. Parents should be able to find out the trigger of the allergies and then avoid the food whatsoever. While there is no treatment of food allergies, preventing it is not so tough and hence can help secure a baby's life. We hope that the above tips have helped you devise a plan to keep your baby safe from food allergies. Always remember, beware of allergy-causing foods for your baby and always keep your baby's health on topmost priority. Thanks for watching.